to know. What are phobias? A phobia is an excessive and irrational fear reaction. If you have a phobia, you may experience a deep sense of dread or panic when you encounter the source of your fear. The fear can be of a certain place, living creature, situation, or object. Unlike general anxiety disorders, a phobia is usually connected to something specific. The impact of a phobia can range from annoying to severely disabling. People with phobias often realize their fear is irrational, but they're unable to do anything about it. Such fears can interfere with work, school, and personal relationships. Genetic and environmental factors can cause phobias. It is unusual for a phobia to start after the age of 30 years, and most begin during early childhood, the teenage years, or early adulthood. Children who have a close relative with an anxiety disorder are at risk of developing a phobia. Distressing events, such as nearly drowning, can bring on a phobia. Exposure to confined spaces, extreme heights, animal or insect bites, and a parent or household member with a phobia can all be sources of phobias. People with ongoing medical conditions or health concerns often have phobias. There's a high incidence of people developing phobias after traumatic brain injuries. Substance abuse and depression are also connected to phobias. Phobias are divided into main three types. Number 1. Specific phobia. This is an intense, irrational fear of a specific trigger. Specific phobias are known as simple phobias, as they can be linked to an identifiable cause that may not frequently occur in the everyday life of an individual, such as fear of snakes. These are therefore not likely to affect day-to-day life in a significant way. Specific phobias are categorized into 5 types. 1. Animal phobias, such as fear of spiders, dogs, insects. 2. Natural environment phobias, such as fear of heights, thunder, darkness. 3. Blood, injection, injury phobias, such as fear of seeing blood, receiving a blood test or shot, or watching television shows that display medical procedures. 4. Situational phobias, such as fear of flying, riding an elevator, driving in closed places. 5. Other phobias, such as fear of choking, vomiting, loud noises or clowns. Number 2. Social phobia or social anxiety. Social phobia is also referred to as social anxiety disorder. This is a profound fear of public humiliation and being singled out or judged by others in a social situation. It can lead to self-isolation. A social phobia can be so severe that the simplest interactions, such as ordering at a restaurant or answering the telephone, can cause panic. People with social phobia often go out of their way to avoid public situations. It is not the same as shyness. Number 3. Agoraphobia. Agoraphobia is a fear of places or situations from which it would be difficult to escape. People with agoraphobia fear being in large crowds or trapped outside the home. Many people with agoraphobia fear they may have a panic attack in a place where they can't escape. Those with chronic health problems may fear they will have a medical emergency in a public area or where no help is available. They often avoid social situations altogether and stay inside their homes. People with agoraphobia have an increased risk of panic disorder. Social phobia and agoraphobia are known as complex phobias, as their triggers are less easily recognized. People with complex phobias can also find it harder to avoid triggers, such as leaving the house or being in a large crowd. A complex phobia is much more likely to affect a person's well-being than a specific phobia. For example, those who experience agoraphobia may also have a number of other phobias that are connected. These can include monophobia, a fear of being left alone, and claustrophobia, a fear of feeling trapped in closed spaces. In severe cases, a person with agoraphobia will rarely leave their home. A person is likely to experience feelings of panic and intense anxiety when exposed to the object of their phobia. The physical effects of these sensations can include increased heart rate, difficulty breathing, chest pain or tightness in the chest, rapid speech or inability to speak and think, headache, nausea, dizziness or lightheadedness, elevated blood pressure, trembling or shaking, sweating, Phobias are diagnosable mental disorders. A phobia becomes diagnosable when a person begins organizing their lives around avoiding the cause of their fear. Like all anxiety disorders, phobias can be treatable with the help of a mental health professional. Treatment options for phobias can involve psychotherapy, medications, or a combination of both. One type of mental health therapy is desensitization or exposure therapy. This therapy involves the supportive and gradual exposure of the person with phobias to situations that are increasingly similar to the one they are phobic about. These circumstances can either include actual or computer-generated anxiety-provoking stimuli. Another type of mental health therapy is cognitive behavioral therapy, CBT. This therapy has been found quite effective to decrease phobic symptoms. It helps the person with a phobia learn different ways of understanding and reacting to the source of their phobia. This can make coping easier. Most importantly, CBT can teach a person experiencing phobia to control their own feelings and thoughts. Antidepressants, like selective serotonin reuptake inhibitor, SSRI, are often used to treat phobias, especially when desensitization and CBT are inadequately effective. These medications enhance levels of serotonin in the brain and can result in better moods. Phobias are also sometimes treated using beta blocker medications. It helps to decrease the physical symptoms associated with panic by blocking the effects that adrenaline hormone has on the body. Treating the phobia will eventually help to reduce negative feelings like shame and helplessness. Thanks for watching the video. For more update to my new videos, press the bell icon. And please don't forget to like, comment, share and subscribe to my channel. Thank you.